As Minnesota continues to reopen its economy, it's good to remember that COVID-19 is still circulating across the state. Tonight, I talked with Dr. George Morris. He works at Centra-Care in St. Cloud. He had some advice for the months ahead. Dr. Morris, let's get started. What is the current situation in your community when it comes to cases?
I work with Centra-Care in central Minnesota, and we've seen our peak, our highest part, and then we are certainly seeing a decrease in the numbers of new cases per day. So we've been pleasantly waiting for this to see kind of our opportunity to be on that downward part of the slope.
Obviously, there's been a lot of group gatherings in the last few weeks, a lot of protests and marches. What do we expect to see come from this? Should we be seeing that data now, or is it too early to say?
I think we're still a little early. What we've been looking for is that 2 to 14-day window. That's when people start to develop symptoms. And we also know by the spread rate, if one person has it during that 2 to 4 day period, they're likely to spread it to 4. And then it'll take another 1 to 2 weeks for those 4 people to spread it to 16 to 64. So we're trying to keep on our toes and keep watching for 1 or 2 weeks after these large gatherings. Do we start to see a small tick up? And then does it start to explode exponentially?
So are we looking at a few more weeks before we could see any difference?
I think we are, and I think that's kind of where we're trying to be on the watch with these large gatherings. We know we're all looking forward to being out more summer. It's beautiful outside. If we can do more things outside with still maintaining the small groups, small family units, small gatherings, and I know we're looking at, public spaces, if there's enough space. And with many of the memorials for George Floyd and the demonstrations and the protests, as you see people walking around, spacing themselves out and wearing face coverings or masks, I think that is something, if we can remember, show our respect, for each other to help decrease that spread, that's where we will really avoid another big surge.
Got it. And as Minnesota has started to reopen, health leaders were saying that we could see the peak this week. Is that still the case, or do we think it's coming at a different time now?
I think as I look at it, I would almost view it as a couple peaks. I think we have had our peak in Minnesota. Our numbers of new cases per day are going down, just as in ours in central Minnesota. However, we're not out of the woods. We still have these small pockets that show up.
We've already started turning the dial here in Minnesota. Salons, restaurants partially reopening with obviously, specific guidelines. What is your advice when it comes to people wanting to enjoy doing these sorts of activities this summer?
I think we should. We should go outside. We should go for walks, biking, hiking. We should be on lakes. We should be on boats and fishing. We should fish from shore. And we should do it in as safe a way as possible, which generally means small groups. Stay with your family unit, your people that you're close to. And that way, typically you'd say you've already been spreading it within the house anyways. So spend time more with the ones you love. Remember to stay a little closer to home. Now may not be the time to, go explore our nation, during these times. And be very careful when you're out in public. If you're in a building, wear a mask, wear a face cover. Those are the times in the large gatherings or the contained spaces where we know the spread is easier. And while you're doing that, be sure you're still maintaining good hygiene. Cover your cough, wash your hands, wash surfaces. We really want to be able to enjoy this in as safe a way as possible.
What about restaurants then? Are you going in, dining in restaurants, and should you be wearing a mask? How does that work when you're eating, I guess?
Yeah, it's hard. So I've dined in restaurants, and what I've seen is they've spaced the tables out. So it's every other table, outside seating where you can maintain as close to 6+ feet as possible. I go in there with my mask on. I talk to the wait staff, and I know that when I'm talking to somebody else that's not in my family, I put my mask on.
That kind of goes into my next question, which is, do you think Minnesota is reopening too early, or does this feel reasonable to you?
I think this feels reasonable. I know it's hard. There's not a right or wrong answer. Much of it is we want to get as close to living with this virus. We need to learn to, whether you want to say wrestle with it or live with it or just manage it. And every day, every week, we're learning new lessons. We have a great state. We have a medically advanced community. We do medically great care. We have a really, world-class prevention side, with the U of M and our MDH and Dr. Michael Osterholm kind of guiding us.
And let's talk about kids. I mean, it's summer. A lot of parents, they don't have summer camps. I'm a parent. I'm constantly wondering, can you go to the park? Can you go to a swimming pool? What's your advice there?
I think we should let the kids do more activities. This is a time when we dialed it into a very safe place of keep kids at home, stop schools, stop the summer youth programs. I think now is the time to slowly open it back up again. If we can go to pools with half capacity, public settings, wide open, generally that's been the guidance, for most of the places is go back gradually. The youth sports programs, what can you do with smaller groups? Act in pods, do more training and more like free play as opposed to the guided, really organized sports. I think there is an opportunity to have a little bit more free play in small groups. And that would, I think, help our social and, by the way, emotional and mental health of the kids and our parents.
Yeah, absolutely. We know, obviously, you're a doctor in Minnesota, but when you look at these numbers in Wisconsin, Minnesota's numbers are pretty dramatically higher for both cases and deaths. I mean, why do you think that is?
That's a hard one. And as I look at the statistics nationally, and we look at Minnesota, even compared with New York, California, Arizona, my sense on it might be that everybody's having their wave just at different times. We're generally, you might say Midwest states, but Minnesota is different than Wisconsin, different than Iowa, different than the Dakotas. And what I kind of have the sense is that if the population density is a little higher, you're likely having spread easier. If you might have certain types of businesses or social gatherings, it's going to spread a little sooner. What I'm seeing nationally is just some of the states and regions are going to catch up. So we're just hitting it at different times.